Hello everyone, how are you? Okay, so we can start. So today we are going to discuss one of the important topic, that is centrally acting muscle relaxant. Again, peripherally acting muscle relaxant also I will discuss. So this is one of the small topic, centrally acting muscle relaxant, and here you can see centrally acting muscle relaxant, and for that you have to know the classification of nervous system. As you know, nervous system can be classified into two types, main two types: central nervous system and peripheral nervous system. So central nervous system include brain and spinal cord, and peripheral nervous system include all rather than brain and spinal cord. So here we will discuss centrally acting muscle relaxant. Next, you can see here this definition. You have Here's something you have to know. You know what you have to know? You have to know definition, then classification of drug, mechanism of action of centrally acting muscle relaxant, and you have to know briefly about drug, specific drug, 2 or 3 drug, then uses and side effects. You have to know these things. This is if you know this may be 3 marks question. Write a short note on centrally acting muscle relaxant, then you can define it, classification of centrally acting muscle relaxant, what are the drugs is used, and mechanism. Only one mechanism means common mechanism how centrally acting muscle relaxant is giving actions, and briefly about drug means a specific drug like benzodiazepine is there, or baclofen is there. Means main what is benzodiazepine, mechanism of action, and uses, or if any side effects is there you can write that, and uses of centrally acting muscle relaxant. Overall uses means around 4 to 5 or 6 uses you can add, and side effects, what are the possible side effects may be there due to centrally acting muscle relaxant. So this is in this session we'll discuss about this. And then this is so central acting muscle relaxant. Here you can see main difference of central acting muscle relaxant means a difference between central acting muscle relaxant and peripheral muscle relaxant. Peripherally acting muscle relaxant. So main difference is this, you can see central acting muscle relaxant decrease muscle tone, but it will not affect on voluntary power means walking movement. But peripheral, if you use peripherally acting muscle relaxant, here you can see this peripherally acting muscle relaxant. Suppose it will act on muscle, it will cause paralysis of that muscle, so body movement will be not there. And again, one of the important function that mechanism, this will be the mechanism of action. This central acting muscle relaxant inhibit polysynaptic reflexes in CNS, But in peripherally acting muscle relaxant, there is no effects on CNS. It blocks neuromuscular transmission. And this you can see it is also important. Central acting muscle relaxant can be taken orally or parenterally, but peripheral muscle relaxant, skeletal muscle relaxant is practically always given IV. Okay, and these are the uses. And this peripheral acting muscle relaxant is used for surgical operation and short-term surgical operation. Okay. Next, you have to know this spasmolytic. You have to know about spasmolytic. So this is the spasmolytic. You have to know the definition of spasmolytic and why this is used. Spasmolytic is used to reduce spasm. Spasm means contraction. It is used in case of skeletal muscle pain. So this thing and spasmolytic actually three types. One is centrally acting, another is directly acting, another is miscellaneous. So centrally acting means centrally acting muscle relaxant. Directly acting, one drug is there that is dantrolene, that is acts directly. And again you can see this is the drug classification of centrally acting muscle relaxant. And here you can see methicillin congener, benzodiazepine, example is diazepam, GABA mimetic, example is baclofen, and central alpha 2 agonist, tizanidine. You have to remember this chart. In MCQs or in questions, you may get this. So next, you have to know directly acting muscle relaxant, that is dantrolene. And you have to know this is only one drug which acts directly to reduce muscle tone. And actually dantrolene acts by reducing calcium entry, means mainly it acts on calcium channel. And this dantrolene is well absorbed from GIT and it can penetrate to brain and produces some sedation. So again, you have to know the mechanism of centrally acting drug, overall mechanism. That is, centrally acting drug acts by two ways. Either it will enhance the inhibition or reducing the level of excitation. You know neurotransmitter, inhibitory neurotransmitter and excitatory neurotransmitter. So this centrally acting muscle relaxant will bind with inhibitory neurotransmitter and its activity will be enhanced. But again, this centrally acting muscle relaxant can bind with excitatory neurotransmitter and reduce the excitation. So mainly, one of the important example of inhibitory neurotransmitter, that is GABA, gamma aminobutyric acid. This gamma aminobutyric acid. After that, what happened? And why these central acting drugs mainly binds with GABA? Because GABA is directly responsible for the regulation of muscle tone. That's why. So when it binds with the GABA, then GABA is the chief inhibitory neurotransmitter in the mammalian central nervous system. So you know the mechanism of GABA. In next slide, you can see. So these are the some specific drug, that is diazepam and tizanidine. You have seen diazepam is belongs to benzodiazepine. So diazepam mechanism of action, means diazepam mainly binds with the GABA, gamma aminobutyric acid, and in GABA also alpha, beta, gamma site is there. So in GABA is binds with the GABA A synapse, and it is useful to reduce the muscle tone. Maybe it is also used as sedatives, hypnotics. So again, another drug is there like tijanidine. This tijanidine. Okay, and you know tijanidine is one of the centrally alpha 2 receptor agonists. Okay, this thing you have to know. Due to tijanidine, some of the adverse drug reaction also there like drowsiness, hypotension, dry mouth, all these you have to remember this. And next you have to know baclofen. And baclofen, where you got this baclofen? It is GABA mimetic drug. Okay, and you see this analog of inhibitory transmitter GABA acts as selective GABA B receptor agonist. Diazepam is GABA A receptor agonist, and baclofen is GABA B receptor agonist. Okay, and this point is important. This baclofen produce muscle weakness, but is less sedative than diazepam. That means you can say baclofen is safer than diazepam. Next, you can see this. This is the common uses. These are the common uses of centrally acting muscle relaxant that are acute muscle spasm. The centrally acting muscle relaxants are giving the or centrally acting muscle relaxant reduces the muscle spasm and contraction of muscle. Then again anxiety and tension due to for treatment of anxiety as well as tension. This centrally acting muscle relaxant may be helpful as because diazepam is used. Diazepam also have anti-anxiety activity. Spasmodic neurological disease. Tetanus. Tetanus means joint spasm. Electroconvulsive therapy. Orthopedic manipulation related with bone. So after that, so that's all about the centrally acting the muscle relaxant. This is very simple. Here you can get only one question. Right? Describe. Here write a short note on centrally acting muscle relaxant. This question may be there. Maximum there will be 3 marks. So you have to prepare based on this. If it is for 5 marks, then you have to describe all. If it is for 3 marks, you can exclude that difference between peripheral and centrally acting muscle relaxant. You can exclude it. Only you can write definition, then drug classification, uses, and uh, that dantrolene, diazepam, baclofen, and tijanidine. These 4 drugs about 3, 4, 5, 6, 3, 4, 5 points. Maximum 3, 4, 5 of 5 points you can write. It will be more than enough. So that's all. Thank you so much. And next I will come with new topic that is peripherally acting muscle relaxant. Thank you.